All right, so here we go. I will share my screen. All right, let me make sure I can see y'all. All right, everybody can see me. Everybody can see my screen. All right, so ethics. So ethics is a system of standards or moral principles that direct our actions as either being right or wrong. So it is concerned with the way people the ways people either individually or as a group decide what actions are right or wrong, if somebody ought to do something, if one has the right to do something, or if one has the duty to do something. A lot of times when we think of ethics, we think of right morals and values, but they really are different. Um, and so when we look at our personal versus professional ethics, so personal ethics, right? Those are the guidelines that you use for living, right? So you choose what your personal code of ethics is. Um, and so, that's going to influence your nursing ethics as well. And sometimes, okay, our personal ethics will conflict with the law, which is our State Nurse Practice Act. And so when we do have this ethical conflict, our obligation is to follow the law. So tell me, what do you think this means? What, can somebody provide an example as to how personal ethics may influence or clash with professional ethics?
Maybe the way that somebody treats like their end of life.
Okay, so maybe somebody treats their end of life. Okay. Vaccines. What about vaccines, right? That could potentially be a conflict, right? If you don't believe in vaccines, right? But we provide education about vaccines. Other ones, big controversial concept is always abortion, right? Abortion is always a controversial concept. And so if you have a personal, you don't believe in abortion personally, right? And have to take care of somebody that is getting an abortion, right? That could also be a professional versus a personal conflict. So good job. Um, so when we look at this, we have what's called the Western secular belief system, and this is the emphasis is shifted from the duties to the rights of the individual. Okay. And so with the Western secular belief system, it has these characteristics. Okay. We have individual autonomy means self-rule. Okay. So people have the capacity to think, and then based on those thoughts, they make decisions freely, whether or not they want to seek health care, right? That is their freedom to choose. If I have the flu, I have the freedom to choose whether or not I want to go to the doctor or if I want to, just ride it out at home, right? Individual rights is the ability to assert one's rights. Okay. And so the extent to which a client can exert their rights is restricted, right? So they can't restrict the rights of others. So, for example, the client's right to refuse treatment can be at odds with the healthcare professional's perceived duty to always act in a way that will benefit the client, right? So, do good, prevent harm. Um, and so there's a number of, situations where this may come into play, right? This could be a cultural, it could be religious, right? So, and I'll use Jehovah Witnesses as an example, right? Jehovah Witnesses they don't, accept blood transfusions, right? And so, that would go against something that we would recommend, right? If they need a blood transfusion, obviously we want to give them one. But the individual's rights is a central theme of healthcare, right? They have the right to consent to care. They have the right to choose between alternative treatments. They have the right to consent or refuse. And then, of course, women's rights over their own bodies. And so that's another big controversial issue, right? So we have our ethical responsibilities, and these are things that, I'm sure you've learned since the beginning of your nursing programs. And so, it's, lots of ethical issues that may arise as part of your nursing practice. So what does it mean to be an advocate?
That's a person that speaks on the patient behalf to it's a person that speaks on the patient behalf when they're unable to speak for themselves.
Very good, right? So when we look at advocating, okay, um, it's a part of our role as a nurse, right? It is something that we have to do. It is something that is our duty to do. When people come to see us, they are vulnerable and they're vulnerable for, I mean, good reasons and bad reasons, right? If somebody is coming in to have a baby, that's usually not always, but usually a good situation, right? And so, um, they're still vulnerable. They're in a vulnerable position, as is that child, and if, of course, if they're sick or they're injured, they're vulnerable. And so, one of the biggest things when we look at client advocacy is knowledge is power. Knowledge is power, right? The more you know. Um, and so, making sure that the client is informed of their plan of care. And a lot of times, this is done every shift, right? It's when you go in to do a procedure, whether it's um, starting an IV or putting in a Foley or doing a glucose, right? Making sure that we are explaining what we are doing. We're not just walking in and just grabbing them and just doing what we need to do. And so again, advocacy, knowledge is power, making sure that they have all the information to make that decision. At the same time, advocacy also includes supporting them when they make a decision. And so even if you don't agree with the decision they make, advocacy includes supporting that decision. What does it mean to be accountable? Mikkel, what does it mean to be accountable? Mikkel? All right, somebody else. What does it mean to be accountable?
Like
The
accepting
responsibility for your
responsibility.
actions.
Right, being responsible, right? So you're answerable to yourself, your clients, their families, your employers, right? Your other members of the healthcare team. So you are held accountable for all the nursing actions that you perform or that you are assigned to perform. Okay, and so how do we measure accountability? How do we measure accountability in nursing? We
Would
have
that be
what
documenting?
documenting, right? It's also the standards of practice, right? What you should do. Um, Colleague reporting. So this is something that I really hope that you never have to ever have to do or ever have to be involved with, but this is something that is super important as well. Reporting peers, supervisors, or even other members for behaviors that are potentially harmful to clients. So whether they are impaired because if they're impaired at work because of alcohol or drugs, if they're stealing medications, if they, are not caring for their patients appropriately, if they're sleeping, if they are verbally or physically abusive to our clients, we have the right to report. We have the um, responsibility to prevent, to report those to prevent any adverse client outcomes. And then
With
system-based
reporting,
issues.
sorry, I
Go
didn't mean to
ahead.
cut you off. With reporting, the first thing that we need to do is confront in any situation, or is that just for sexual harassment?
That's just for sexual harassment. Somebody is specifically hurting, like coming at you. Um, with client reporting or with colleague reporting, always go to your supervisor, your manager, somebody that can handle the situation. You have to be careful with, right, confronting that type of behavior. But like, so for me, for example, I work night shift, okay, and I have caught, people sleeping on the job, which, unfortunately does happen. You can address the issue, you can address the issue. If it's a one-off thing, you still should report it because you're still potentially putting clients in danger. With system-based issues, identifying system-based issues helps to provide safe, high-quality care as well. So, working in healthcare, there's new procedures, there's new equipment all of the time. Um, and so, if you don't get the right education or training about the new equipment, the new procedures, right, that is something that could be dangerous. So you need to notify administration, and, get a plan so that you can get training on that new equipment or that new policy. You never use new equipment if you have not been trained on it, right? Because you, could potentially cause harm to somebody. I was reading, um, what was I reading? I was reading I think it was just an article about a CNA who was using a Hoyer lift by herself and dropped the patient and the patient died. Did anybody else see that? Yeah, and she was like I think she was a new CNA.
I
I think
did.
you did. I
Mhm.
think she was a new CNA. Wasn't she a new CNA, Julie?
Yeah, she did. Yeah, she was a new CNA.
It was in Florida, right, Jew?
Yeah, it was a Warrior. They dropped it with a Warrior.
Oh, it was in Florida though, right? I remember you.
Yeah, it was in
Yeah.
Florida.
Yep. So, I mean, I didn't, go through like what her training was or anything like that, right? But that you can see, we know when we use Hoyer lifts, how many people are we supposed to have? At least two, right? Um, then I had another one. This was actually recent. It was one of my patients. They were at another facility and I don't know exactly what happened because they were at another facility, but it was a similar situation. They were using they used the Hoyer incorrectly and they dropped him and they broke his hip. So I was like, it was really crazy. I was like, I felt really bad for him. And then I don't know what happened to him because he got transferred out and I don't know where he went after that. All right. So we have our principles of ethics. Am I going too fast? Do I need to slow down? Okay. All right. Just want to make sure. Um, our principles of ethics. And I know you guys have heard these before, the non-maleficence, your beneficence, your autonomy, your fidelity, and your justice. So non-maleficence means to do no harm. Okay. And so it's the basis of a lot of rules that you hear, not just in nursing school, but out in the workforce as well. And just as a reminder, guys, please get on camera. There's a couple of you that are not on camera, so I'm just reminding you. Um, so examples of doing no harm, following your rights of medication administration, using your S-bar, even the little things like before we leave a resident's room, what do? We put the bed in the lowest position, right? We make sure that they have their call bell, right? Their TV remote, they can get their water, right? All of that stuff. Um, so, making sure that, we're caring for them appropriately. Um, Your beneficence means to do good, okay? And so this is the basis of trust, okay, in nursing. It also, is preventing harm as well as removing harm. All right. And so with beneficence, we're putting the client's needs first. Okay. So at the end of your shift, right, you're making sure that you are doing proper turnover to the next nurse that's coming on. If we make a mistake, like give the wrong medication, that we report it and that we can monitor our patient. So again, it's placing the goods of the needs before our own. Um, Autonomy is the freedom to choose. And so this kind of goes back with advocacy. Let it, if they have to make a decision, it's thinking through all the facts, deciding on what, they want to do. It's based on independent thinking process, acting on that decision, and then even making sure that they are acting on that decision without pressure from anyone else, right? And so whatever the decision is, okay, we want to make sure that they have the information that is needed to make an informed decision. Privacy is also part of this too, because privacy is both a legal and ethical issue. And so autonomy does include that client's right to privacy, right? And so when we look at privacy, we have to be really careful, and not share information that shouldn't be shared. But it also includes the right to choose care based on their personal feelings, their beliefs, or even their attitude. So it's their body, right? They get to choose what is done to them. Fidelity means to be true. All right. And so always acting in the client's best interest. Okay. Especially when they don't have the ability to make that choice themselves. So think about this, when I know it sounds a lot like, what was the word? I forgot the word I was thinking of. Um, Doing good. But this is also not talking bad about your clients, not labeling your clients as troublemakers or difficult patients. It's also when you hear somebody else talking bad about a patient or a client, it's stopping them, right? So it's just like I said, it is being true to your clients, especially when they're not available to advocate for themselves. Justice means that you're delivering fair and equal treatment to all clients. You're recognizing, and you're avoiding any personal biases that may occur. Um, but then we have this term. So, beneficent paternalism. All right, this is a term you guys need to understand. So, beneficent paternalism is actually a disrespectful attitude towards the client and what the client has to contribute to personal care. So, it's an I know what's best for you kind of attitude, kind of like how we treat our kids, right? Especially when they're younger. I'm the mom. I know what's best for you, right? And this is how we're going to do it. However, we don't usually have this in healthcare, okay, because they have autonomy and they have the right to free will to choose and make their own decisions. The only time that beneficent paternalism is justified is in an emergency or an extreme situation and is most often a medical decision, okay, that needs to be made. So we can use this. All right, the healthcare provider can go to the court to be allowed to do a potentially life-threatening or life-saving, not life-threatening, life-saving procedure if a parent has refused to sign an authorized treatment form for the child. Okay. But it has to be life-saving. And so I had a student ask me once, um, about Jehovah Witnesses. Okay. So we know Jehovah Witnesses, right? They don't accept blood transfusions. That's part of their religious beliefs. And as an adult, they will refuse blood transfusions. However, okay, if we have a child who needs a life-saving blood transfusion, then using beneficent paternalism, they can petition the court in order to give them that blood transfusion. Okay, does that make sense? All right, so again, we are only going to use this in an extreme circumstance, and it's usually only when a parent is refusing to save the life of a child. All right, any questions on ethics?
Question. So
Yeah.
if the parent refuses, being as though they're an adult, you just document and let the physician know, right?
Correct. If it's an adult and they refuse, then that's absolutely fine. Yep, we would just document their refusal. But I want to say too, is always, oh, we talked a lot about like stereotyping, right? And putting people in groups. Um, I had a patient who was a Jehovah Witness who needed a blood transfusion, and we had done the oral iron route, and we had done some other things to try to get his hemoglobin and his hematocrit up, and it wasn't enough. And so the doctor had recommended him or told him that he recommended he get a blood transfusion. And a bunch of nurses were like, oh, they didn't even present it to them to be like, hey, do you want us to send you to get a blood transfusion? But when the client was asked, like, hey, we can fix the issue, we can get you a blood transfusion, he 100% agreed. Okay, so we have to be careful when we don't want to just put them in a group, right? We always want to treat everybody as an individual and ask those questions. All right. So then chapter 7 is all about nursing and the law. All right. And so these are some of the terms that we'll talk about throughout accountability, advanced directives, assault, authorized consent, battery, confidentiality, defamation, felony, informed consent, libel, malpractice, misdemeanor, and negligence. So, everybody should know what your Nurse Practice Act is at this point, right? And if you don't, please go to the Board of Nursing website and look at your Nurse Practice Act. But your state Nurse Practice Act defines nursing practice and establishes the standards for nurses in your state, right? So as an LPN, as an RN, as a nurse practitioner, okay, it is going to outline what the standards are in your state. Ignorance of the Nurse Practice Act is not a defense against legal proceeding regarding your license. Okay, so if you do something that you're not supposed to do and is outside of your scope of practice according to the Nurse Practice Act, you are going to be held liable for that. Okay, and you can't use I didn't know as an excuse. There are lots of similarities across the states, hence we have those multi-state licenses, right? So you can get a state in your current, you can get a license in your current state of residence. And a lot of times, if you choose you want to go travel, you can travel as long as those, state that you're traveling to is also a compact state. But it's even for people who, maybe you live in Pennsylvania, but you're closer to Jersey than you are anywhere else in Pennsylvania, right? You want to go work in Jersey, or if you live in Virginia and you want to work in North Carolina or Maryland, right? Depending on where you live, right? It makes it for ease of access as well. So, content of the Nurse Practice Act. All right. So, the Nurse Practice Act, your rules and regulations of each state commonly include the general provisions. So they outline the functions of the State Board of Nursing, the general procedures like fees, the licensure process, elements of what they would consider unprofessional conduct, information related to reasons for a suspended or revoked license, as well as the impaired professional program. The responsibilities under the Nurse Practice Act, they, describe the general functions of the licensed nurse, again, whether it's in LPN, LVN, or an RN, the definition of nursing, and there is a specific definition of nursing for LPN, LVN, and professional nursing or RN. They also will, what our standards of nursing conduct are. They also organize, approve, and administer an organization, approval, and administration of nursing programs, and then continuing education. I'm going to talk a little bit more about that as we go in. So we go down now to our state boards of nursing. So the State Board of Nursing, if anybody, that is where you're going to apply for your nursing license after you graduate, right? It's where you are, if, knock on wood, anything should happen, that is where you will go to, defend your license should need be. So some of the common functions of the Board of Nursing: licensing and certifying. Okay, so again, you apply for your nursing license, right? They're going to do your background check, they're going to get your transcripts, and then they're the ones that are going to decide if you can go take your NCLEX. There are also some specialty certifications. It just really depends. A lot of your specialty certs are from outside associations. They set the fees. So how much does it cost for your initial nursing application? How much does it cost for you to renew your nursing license? It also establishes the standards for educational programs. So programs like Fortis, right? They have to be approved by the State Board of Nursing in order to operate within that state. They also determine the duration and renewal of licenses. All right, so how often do you have to renew your license? Most states, it's every 2 years, you have to renew your license. Some boards will require continuing education credits for the renewal of your license. Pay very close attention to that. Okay, I have seen nurses get their license suspended because they did not complete their continuing education credits. All right, and there is a minimum per year. Okay, so you can't do them all the month before your nursing license is due. You have to complete so many hours per year. They also maintain inactive status lists. Any violations, they are going to carry out the disciplinary action. They develop programs for impaired nurses. They also suspend and revoke licenses. They deal with the appeals process. So let's say you have an alcohol problem or you have a drug problem, okay? You can self-refer in most cases to your State Board of Nursing. There is an impaired professional program that is offered through most state boards of nursing. Does not mean that your license is not going to be suspended, okay? It just means that if you comply with the requirements of the impaired nursing program, that increases your chances of getting your license back as long as you participate in the program correctly, appropriately. So I have seen nurses get referred through the program and then refuse to get their drug screens and do their counseling or whatever. I don't know. I don't even know what they all do, but whatever it is that they do, I have seen where they have been dismissed from the impaired nursing program and have not been able to get their license back. So, disciplinary responsibility of the board. So again, each state's Nurse Practice Act lists the specific reasons why they would seek to discipline a nurse for unprofessional conduct. Okay, and the language is going to differ from state to state, but a lot of it is, really kind of the same. One thing that you have to know is the Board of Nursing is there to protect the public Okay, so it is a safety thing. So the disciplinary action is focused on our client's safety. Um, so typical examples of unprofessional conduct, boundary issues, okay, having relations, or relationships, not relations, relationships with clients outside of like that nurse-patient relationship, practicing while you're impaired, violating client confidentiality, failure to supervise persons that you've delegated nursing actions to. So if you've delegated something to a CNA and you didn't supervise them appropriately and something happened, inaccurate documentation or recordings, falsifying or altering client or healthcare provider record, sexual misconduct. Okay, so there's lots of different things that somebody may get called up for unprofessional conduct. In some cases, too, conduct that occurs even when you're not at work can also go against your nursing license. Um, DWIs, felonies, assault, battery. There's a variety of things that even if um, that you do these things outside of the nursing profession, then you could also lose your license for that. So what will the board do? All right. So they can give you a fine or a civil penalty. They can refer you to an alternative to discipline program for practice monitoring and recovery support. They can do public reprimand or censure. They can give you impose requirements for monitoring, remediation, education. They can limit or restrict your license. They can even tell you where you can and cannot work. Okay. They may suspend or revoke your license, or they may provide some remediation, and there may also be some state-specific violations. So I'm going to give an example for which one is it? So educational content. I actually know somebody who had gone in front of the board of nursing because he called out sick from work and falsified his doctor's note and turn that in. And how they figured out it was falsified, I do not know. But they reported him to the board of nursing, and he had to do some continuing education, and I forget what it was. So yes, so be very careful. Unprofessional conduct, your negligence. So negligence is not doing what a reasonable, prudent nurse would do in a similar situation. This includes serious risks to the health, safety, or physical or mental health of a client. Violations of the Nurse Practice Act, we already talked about this. Some states will list very specific violations like becoming personally involved with a client. I mentioned that already. Incompetence is, failure to meet generally accepted standards of nursing practice, negligence, or a nurse's mental disability that would interfere with client safety, unethical conduct. So this could be a breach of nurse-client confidentiality, refusal to provide nursing care to someone because of race, creed, color, national origin, disease, or sexual orientation. Failure also to maintain nursing competence, keeping your skills up, your knowledge. And then, of course, alcohol and other drug abuse. So whether it's diverting medications for your personal use, that is a threat to client safety because now that client is not getting their pain medication. So be very careful. Some nurses steal and sell diverted substances and equipment, such as syringes and IV tubing, falsify client records, depriving clients of their medication. I had a nurse that I worked with back when I was at LPN. She was actually one of our supervisors. Um, and the rule is that if you, and especially in long-term care, if you're, we have to get rid of narcotics, okay, whether the patient discharged, passed away, whatever, they can't be returned to pharmacy. So there's a process that's in place to destroy those medications, and it's two nurses have to sign off. So this nurse would destroy the medication, and in essence, she was stealing the medication and she was selling it and she was using and selling. And she got caught and lost her nurse's license, which I mean, honestly, should have happened, but yes. So just be very careful. You guys work very hard, okay, in nursing school to get your education and then passing that NCLEX, and just make sure that you do everything that you can in your power to protect your nursing license. So if something happens and you get reported to the Board of Nursing, okay, so the complaint is filed, all right. So in this case, a nurse is reported for stealing a client's narcotics to the State Board of Nursing. The state board is going to look to see if the patient's behavior was unsafe, incompetent, or unethical. It's also going to see that if a chemical or alcohol or medication or something is affecting the nurse's physical or mental condition, their judgment, making them unsafe to practice, and confirming that the stolen narcotics are a violation of the Nurse Practice Act as well as the law. Then the board will review the complaint. And so again, they're going to verify what state the nurse is licensed in. They are going to verify whether the act is regulated by the Nurse Practice Act. And if there is a positive criminal background check, they're going to do interviews and gather evidence. It is not until we get to the actual board proceedings. So this is all behind the scenes. So they get the complaint, they're going to work through the complaint, they're going to do the investigation. It is not until we get to the board proceedings that the nurse actually will have the chance to respond to the allegations. That is where they get to tell their side of the story, so to speak. And then, there's different things that can occur. There's formal hearings. There's also alternative to discipline programs that can occur. But the board action is going to follow the board proceedings, and that is where the disciplinary action is going to be determined. All right, whether they, immediate suspension to protect public, disciplinary action, remediation, and then we have the reporting and the enforcement. Okay, so reporting and enforcement, there's a website, and anybody can go to this website. It's called Nurses. It is a national database for verifying licenses, discipline, and action privileges for nurses. All right, and so this site contains the nurse's license number, the date of license expiration, and any violations. And I'm going to stop sharing because I'll actually show you what this I will show you what this website looks like. So I'm just going to put my nursing license in because so this is Nurses. Like I said, anybody can go on here to verify a nursing license. So you do have to have some information though. So you have to know their first and last name, their license type. You have to know, it's the only thing that can be difficult with a quick confirm if you don't know necessarily what state their license is in. However, I'm going to do it this way because contrary to what popular belief, Jennifer Martinez is actually a very common name in Texas. So if I pull it up, it's going to list. So I'm going to actually put my number. If I remember my number, even better. 979. All right. And then I will show you what a report looks like. Sometimes it takes a minute. All right. So here is my report. Okay. So here's my practical nursing license, my Virginia RN license. When I first moved to Texas and in the process of transferring my license, they actually issue a temporary license. And then this is my full license. Okay. So my name, my type, my state, and my license number. And if I go to view report, it is going to tell you all about my nursing license. So you can see my RN and my PN licenses are both expired, but my RN in Texas is active. So you have my name, you have my state, my license number, the date that it was issued, and the date of expiration. I do have a multi-state license and it is unencumbered, meaning that there is nothing on my license. I haven't done anything wrong. I've never been in front of the board of nursing, and I plan to keep it that way. Okay, so this is what it would, or what the report would look like. If this said yes, okay, then you could actually, I don't know, I've never looked on here, but you can click on there and see what the violation was.
I got a question.
Sure.
So like with the multi-state license, do you have to take like another test for that or okay.
No. No, the NCLEX is a national exam. Okay, so whatever state that you are residing in, you can take that. You take the NCLEX, that state will issue your multi-state license. The only time, and it varies by state, so I'm not going to say 100% yes or 100% no. Um, but I will tell you that depending on what state you're going to, there may be some additional requirements. For example, nobody's in New York, right? Nobody's in New York. If you wanted to get a license in New York, they require some, I think it's like child abuse continuing education. In Texas, you have to take a jurisprudence exam. And so even though I had a multi-state license when I transferred my home stay, my residency from Virginia to Texas, I had to take a jurisprudence test in order to get my license. So you still have to look. There's still maybe things that you have to do to transfer your license should you choose. But let's say I decided that maybe I wasn't going to live in Texas, but I was just visiting Texas. I wouldn't have to transfer my license. It's only if I'm changing my state of residency. So I physically up and moved. But if I was here just on a contract, I wouldn't have to transfer my license. Does that make sense? So yeah, so it's just a little bit different. But I will tell you, it is nice that nurse compact, the nurse, what do you call it? The nursing compact licenses or multi-state licenses are actually really cool. If you want to work across different states or travel, that's always there. And then we have the what is it? The National Practitioner Data Bank. It's at the it's like a tongue twister. Federal law requires that adverse actions or disciplinary actions taken against healthcare professionals licensed also is reported to the National Practitioner Data Bank. We talked about that. And Ty told you, right? Making sure that we're providing that supervision to our UAPs, especially when we delegate care. So nursing standard of care, right? That's your guidelines for good nursing care, right? You're held to that nursing standard of care. It has legal implications. Okay, and so standards of care based on what an ordinary, prudent nurse with similar education and nursing experience would do in similar circumstances. All right, and so there's a variety of resources that you can look at to learn about standards of care, understand standards of care a little bit better. Of course, your Nurse Practice Act is one that identifies your minimal level of competency for you to function as an LPN or RN in your state. The NCLEX, then passing the NCLEX, that shows that you have minimum competence to perform your actions, your nursing programs, based on the guidelines from the Board of Nursing. The nursing programs guarantee a minimum knowledge base, right, and clinical practice necessary to provide safe nursing care. I'm trying to think of what else. Organization, policy and procedure. So where you work, that is going to be another really good one. And we're almost out of time, but I wanted to say with that, your Nurse Practice Act in your state, that's an umbrella. Okay. This says this is what you can do. This is what you cannot do. Your organization cannot have you do anything outside of that umbrella. You have to stay within that umbrella. They can minimize it. So, for example, let's say we know that you as an LPN can do IV medications. Okay. But the organization that you work at may say, we don't want LPNs doing IV medications. They can't, and as an LPN, you can't IV push medications. So your organization can't say, oh, it's okay for you to push that medication. Does that make sense? So they can limit your practice, but they can't go beyond what that nurse practice says you are allowed to do in your state.
Wait, I have a quick question.
Sure.
LPNs can't push any meds through the IV?
Mm-mm.
Okay. I thought it was like a few that we
Yeah, I
could,
thought
but
it was
okay.
just NARC. I thought we just couldn't push NARCs.
That's what I thought
Mm-mm.
too. Because one of my friends who just graduated, she literally just asked me this question because she just started a new job and I guess she had to do, they were asking her to set up like